I want to talk about energy medicine for a second because how does that even present itself? Do they have to be sedated? How do you get a dog to sit still?
No.
How,
So the
tell me.
first, yeah, that's a great question. The first session for acupuncture, I feel like is a hit or miss. Like dogs are usually like, what are you doing to me? Don't touch me. What is happening? But I always do it with the owner. So I'll have the owner sit in the room with us. The owner's feeding treats, and while they're distracted, I'll stick my needles in. Usually the dog feels better. So the second time they're coming in, they're a little bit calmer. And by the fifth or sixth session, they're letting me do whatever I need to do. So
Really?
I'll focus mainly on back points in the beginning because that's easy to get to and they don't really care about them. And as we do more and more sessions, I can start doing the legs, the head, the eyes, whatever else I need to because they're a lot more comfortable with it.
Got it. But how long do the needles have to be in?
20, 30 minutes. So
Oh,
they'll
wow.
usually I'll put one on the head, which is a calming point. So once I put that and it sits for a little bit, they'll kind of relax. I'll leave the room. So it's just mom and dog, and they'll just hang out for 20 minutes. And then someone comes in and takes the needles out.
So that sounds really scary to me. Like we live across the country from each other. So like I would have said, okay, after this, I'm making an appointment with you for my dogs. But how do you actually find someone that really knows how to do this and is trained properly in dog acupuncture? Is it easy to find someone in your area?
Yes, it is. So there's a website called ivas.org that has all of the certified acupuncturists in your area. So if you really wanted to go to someone, all the veterinary certified acupuncturists, it'll pop up their location and their names. Most acupuncturists are mobile. They'll come to your home and they'll do it in the comfort of your home, which is
Oh, no
really
way.
nice.
Oh,
Yeah.
wow. And okay, but is there some sort of major certification that is different on a dog than in a human, or are the body parts all sort of the same? Like if you use one part of the body, it's going to something.
That's a great question. I did an animal certification course, but I've seen human acupuncturists do acupuncture on dogs and have the same response.
Got it.
So I think, it's really how comfortable you are with it. I don't really want to touch humans. I don't want to learn about humans. So I focused just on doing the veterinary medicine portion of it, and I
Yeah.
really focused on just the animal aspect of it. But I have seen some human acupuncturists who went and got certified in dogs as well.
Got it. And just so people understand, what falls under the umbrella of things that you should go to an acupuncturist for your animal?
Everything. So people think it's just joint related. It's not. I've seen people come in for masses, and you can do things around the mass to help shrink it a little bit. For poor energy, there's points that you can do for that. For chronic kidney disease, you can do it for GI issues. Some really great, wonderful holistic doctors don't treat diarrhea with anything but acupuncture points. They'll do a couple points. They don't even put them on any medication or diet change, and that's all they do. And it's true. It works really well.
Wow.
You can use it for moods. So like if you have a dog that's really anxious or really nervous, you can use it for things like that as well. So you can really use it for a lot of things. I used it once. A dog came in for an ulcer, a scratch on the cornea. I got a little bit of blood from him and I put it right back under his eye in an acupuncture point, and that eye healed up more than it would have with an antibiotic ointment.
Oh my
So
God.
and there's science behind this. It's evidence based. It's not just like you said, it's not just like magic. There's actual evidence behind how the body functions together.
Right. A lot of people have written into me and talked about dogs itching or biting on their paws. Now, I think there's been some studies that it could be allergies from your grass, from your food. It could be anxiety or they're bored. How do you, what would you do for dogs that have biting on their feet?
So first we want to rule out what type of allergy it is. And the first thing I do is a diet change. That's the first thing I do is if your dog is on kibble, I always try to get them onto a fresh food diet and I always try to change their protein source.
Mhm.
That's why I'm such a big fan of Badlands Ranch. There's absolutely no fillers in it. There's no corn, there's no wheat, there's no soy. Those are the things that cause allergies if you don't have a protein allergy. So getting on a fresh food or food like that, you're taking all the allergens out of the equation. If the food doesn't help, that means yes, you have an environmental allergy.
Mm.
Topical therapy is the best for that. I know a lot of people like the steroids and the Apoquel and medication like that for allergies. Those are immunosuppressive. So yes, it may fix one problem, but eventually it's going to cause tons of other problems. And we're just we're masking the whole thing.
Mm.
So I will do a lot of topical therapy. If you know that your dog's allergic to grass, when you bring them back home, clean their paws up. Take a couple extra minutes, clean their paws with a little, paw wash, put a little medicated wipe on them, and usually that does the trick. You don't need to do anything more.
Right. Okay. So if I'm a pet parent and I want to give my dog or cat the longest life possible, obviously we've talked about a couple of things. Change from kibble, that kind of stuff. Maybe look at doing some acupuncture, looking at the gut health. First of all, how do we know if they're starting to feel sick or that their age is starting to show? Because it represents different in pets than it does in people.
That's a great question. So, in holistic medicine, we do a very specific type of exam. We'll check their pulses, we'll check their tongue, but we also check their coat. And all of those things show us signs of early aging and things that we need to start working on. So, in conventional medicine, you're checking baseline lab work, which is your basic blood work, right? You're
Right.
checking your liver, kidney values, your urinalysis, and maybe you're checking for anemia. In holistic medicine, we take it a step further. We check for vitamins that are essential for dogs to live and age naturally. If vitamin D, magnesium, cobalamin, folate are low, that's a sign that they're not getting it nutritionally and they're going to start showing signs of aging and disease soon. So then we'll supplement those things into their diet with liquids or capsules, things like that, and retest them every few months.
Is there some sort of warning sign that you know that you would like people to hear that they should look out for, that they should immediately like start changing something, go to a vet like you, that we may not know of?
Yeah, if your dog has chronic ear infections, is slowing down, is not wanting to eat anymore, always has diarrhea that you're having to get treated every few months, that's not normal. Like that shouldn't
Mm,
be happening. That's a sign that there's a bigger root cause that we're not treating, and we need to
yeah.
dive in deeper.
Right, because it's interesting. I follow a bunch of people that talk about their dogs all the time, and next thing you know, the dog's like dead, and they just found out the dog had cancer, and it's really upsetting for the entire internet to watch this happen. But it seems
Yeah.
like it comes on so quick, and that I just feel like there's got to be ways to have seen these signs a lot earlier. I mean, I feel like as a pet owner, you really know your pet, almost like you know your kids. So you know when something's off. But,
Yeah.
people kind of hesitate to bring the dog to the vet because sometimes we don't even feel like, you know, it's not that vets don't know what they're doing, but vets sometimes just look in the ears, look around, look at the gums, and they're like, nope, let's just put them on this for a couple days and you'll be fine. And you have a $500 vet bill. So people, I think, hesitate and they just wait it
Yeah.
out.
And I understand that. I think the cost of veterinary medicine is a big topic right now. And I think
Yeah.
when we're like, I want to do blood work and I want to do this, it's really scary because
Yeah.
insurance doesn't always cover that. And so people are like, well, I'm not going to do that. My dog is fine. The other thing as well is that dogs are like family nowadays. They're like
Yeah.
kids to people. So they can't even imagine anything being wrong with them. So it's really hard to kind of get through to that. I had one client who came in recently. She's my favorite lady, but she adopted a dog from a rescue, and the dog had terrible anxiety and then started itching. And she's like, I just want my Apoquel because I know it works and it's quick and easy and it's fast. And I fought her so hard on it. I was like, I promise you, if you change the diet and it doesn't work, I'll pay for your bill. Like I promise you. The dog, she begrudgingly changed. She was so upset with me that I wouldn't give her the Apoquel, changed the diet, gave it 6 weeks, came back. His anxiety was gone. It wasn't itchy anymore. And now you don't have a bunch of bills for medications that you didn't need in the first place. All
Right.
you're doing is feeding your dog. That's all you're doing. You don't have to worry about medicating them or anything. And
Yeah.
I think that's a concept that is really hard to understand for some people.
Right. Right. You talked about herbal medicines earlier. That sounds like a bunch of Chinese stuff. So tell me about that.
Yeah, that's a great question too. So when we look at baseline lab work in holistic or integrated medicine, we look if it's in the normal range, but on the verge of too high or too low, we look at things like that because we want to catch things before they happen. We want to prevent things. So I will put patients on herbs to help support their thyroid or their kidney if I feel like they're on the verge of showing signs of disease.
Got it.
Some conventional doctors see normal and that's it. They don't really go that extra step, which is when we start to see disease and then you treat the disease after it's already occurred. We try to do that before it
Right.
happens. So that's where the herbs kind of come into play. Also, I've used herbs. So some things we can't treat and we have no way of making sure it doesn't happen. Like Pomeranians are prone to collapsing trachea as they age. They have, that cartilage gets weaker as they get older. They start to have this gross goose honking cough.
My dog
Slippery
has that.
elm. Yeah, slippery elm, which you can get online, and I can give
I'm
you a link
writing
if
this
you want
down.
it. It's a wonderful herb. It's an absolutely wonderful herb. It really helps to moisten the in any mucous membrane. It's also really good for digestion, but I use that for collapsing tracheas. And you don't need to go on any other medication, any cough suppressant, anything else.
Yeah, they put her on so many things. They put her on Serenia. Do you know what I'm talking about?
Yeah.
Yeah.
Yes. Yeah.
But it's like the middle of the night. She wakes herself up and me 5 times a night with this terrible
She's
cough.
coughing.
And when other people hear it, they're like, oh my God, is she okay? And I'm like, this has been happening for 4 years. This is just what she has. I knew
Yeah.
immediately it was a collapsing trachea, which of course that scares me because you never know when that's going to be so serious that she can't breathe. But I've been managing it with regular medicine. And so, no, I'm glad you brought that up because I will try the slippery elm because,
Yeah.
it's,
And just remember, it's an herb, so it's going to take longer to take effect. And I think that's something that like some people will get impatient about is I gave it a week, it didn't work, I'm over it.
yeah,
Holistic medicine, alternative medicine, it takes time. It's making changes in your body. It's going to take time to do that.
sure.
So just don't give up on it. So I would say do it for a month and then see how things go.
Right, which is similar to the advice they give you with stem cell treatment in
Yep.
humans too. Like you go, I just went to Panama and I got stem cells. And part of the thing that they were explaining to me is like, don't think that like tomorrow you're going to feel better. This is within. It takes a
Yeah.
while. And that's been the worst part of coming home from it because I'm like, okay, I should be
I
looking
feel
and
the same.
feeling like I'm 17. I'm still 50. So, like, what's happening? But it's only been a month, and they keep saying, like, you got to give it a couple months to really find its way through your body and integrate.
Yeah.
And do they do stem cell treatment within pets as well?
They do. They do. It's really
Wow.
cool. You can do stem cells into the joints. You can do it for a lot of different reasons. I've seen it mainly in the joints for dogs that are really showing debilitating signs of arthritis. They'll put it into
Yeah.
the joints to help them walk better and save their joints while they can.
Amazing. All right. When is the point that you know you have to integrate the two medicines, though? Like what you guys offer might not be enough that you have to
Yeah.
call in the regular veterinarian
So
medicine.
believe it or not, usually holistic medicine is a second opinion. So we get all the really hard, complicated cases because they can't just figure out what's going on.
Oh
So
no.
cases like immune-mediated diseases, like a dog that has immune-mediated hemolytic anemia, they need to be on steroids to help manage this because if they don't, their anemia gets so low that they'll die. I will still keep them on their medication, but start doing things like acupuncture, ozone therapy. Maybe we'll do some herbs to help support their immune system and their health so that they can taper that dosing of steroid to the lowest effective dose instead of being on a high dose of it and still staying healthy.
Got
Dogs
it.
that have, no, like if you have a UTI, of course I'm going to give you antibiotics. It's not that we don't believe in antibiotics, but if we're going to do that, you need to also give a probiotic. You need to also support the immune system because antibiotics are still killing that gut health that we need.
Right. Right. You said ozone therapy. What is that?
Ozone therapy it's been around for 100 years. It's a big tank that you sit in. Well, no, that's hyperbaric chamber. Ozone therapy is when you have it has an extra piece of oxygen attached to it. And so
Okay.
it's just ozonated air, essentially. And it helps with cancer, immune system, wound healing, so many things. I had a friend whose dog had osteosarcoma that she bought an ozone machine and was doing it herself at home to give herself energy, to give her dog energy while they were dealing with the cancer. And so it's a really, really great way to help boost the immune system. It's a healing, it helps with healing. People do it in humans as well.
Does red light therapy work in dogs like it does in
Yeah, it does. Laser therapy is wonderful. I'll use it sometimes as a secondary thing to acupuncture. I'll do
Okay.
acupuncture and I'll do laser on top of a part that's really painful. Or if I notice that I got a pain response somewhere during my needling, I'll do like a little bit of a localized laser there. We use laser
Amazing.
therapy for wound healing as well. So after I spay or neuter, if I took a bunch of teeth out, we'll do some laser therapy there for inflammation.
Got it. Um, okay. How do you measure success in extending a pet's health span, not just lifespan?
So I look at again the whole pet. If your pet is debilitated and yes, they're eating, but you have to force it and they're not really going on walks and they don't have a good lifestyle, that doesn't mean that I'm doing my job well. I
Mm,
want the dog to be able to do the things that they love. You know, I want him to go for his walks. I want them to play if they want to and eat and be happy when they eat. And so those are the things that we really look for. And the owners are a big part of that. You know, like you guys are giving us the history. You're telling us what's normal and what's not normal for your pet. And that's a really big part of making sure that we're successful.